The potential cost of tests and treatments for the coronavirus could cause some people to delay seeking medical care, and that could delay could expose others to the virus. As part of our series, Medical Price Roulette, a collaboration with Clear Health Cost, we're taking a look at what some Americans are paying. Our consumer investigative correspondent, that's Werner, has been talking to people who received big bills.
I started to get a fever, just started to feel kind of chills. And I was just like, oh, crap, whatever they had, I think I got it.
Walking Dead actor Daniel Newman got sick in early March. Worried he might need to warn others if he were infected, he went to a Georgia hospital where doctors tested him for the virus, but then told him,
we are not allowed to process the tests because there's a really limited bandwidth or capacity on how many tests can be processed per day. And so we are not allowed to send off the test for anybody that has mild symptoms.
He never did find out whether the test was positive or not, he says. But on the way out, he asked, was the cost covered?
And they were like, no, you just came into an emergency room. It's going to be thousands of dollars.
The bill came to over $9,000, an amount he says his insurance company is refusing to pay.
Yeah, a lot of money.
Yeah. And that, not even on a personal level, on a humanitarian level, that infuriates me. The fact that no one can afford this. How can a family of 2 or 4 kids afford even one person at $9,000, much less 4 people?
On March 18th, Congress passed the Families First Coronavirus Response Act, under which health insurers are required to waive cost sharing for coronavirus testing. Several major insurers, including United Healthcare, Cigna, Humana, and Aetna, are also waiving copays for coronavirus treatment. But it's not true of all insurance plans. Dr. Tom Inglesby heads the Johns Hopkins Center for Health Security. We spoke with him before the shelter-in-place orders.
If people are scared that this won't be paid for, what happens if they don't get health care, if they don't get diagnosed?
For most diseases, this would be an individual decision, and people would be taking risks into their own account. But here, if people fail to get tested, it's basically a risk for everyone. It's a risk for society.
Do you worry most about the uninsured?
I do. I worry about the uninsured or the underinsured. Those who have such high deductibles that they won't kick in until they've spent an enormous amount of money trying to take care of themselves.
The health insurance industry is warning future insurance premiums could spike and is now asking Congress to set up a backstop contingency program that, if needed, would cover a portion of related costs over the next 2 years to protect Americans from the consequences of potential catastrophic costs.
I think this whole coronavirus has exposed the holes in our healthcare system.
Representative Jan Schakowsky told us of her concerns in early March.
I think this is going to make it worse. Maybe in the long run, because it'll expose so many of the problems, maybe we can make some of the corrections. But we are dealing immediately with a crisis that we're not really prepared for.
A 2019 census report says some 27.5 million Americans did not have health insurance. That's about 8.5% of the U.S. population. By the way, we reached out to Daniel Newman's insurance company about that $9,000 bill. We didn't hear back, but we want to hear from you. What are your concerns about costs and your insurance coverage? Are you losing your insurance coverage? Email us at healthcosts@cbsnews.com. Again, Gail, that's healthcosts@cbsnews.com. We really do want to hear from people. Tell us your stories. Gail?
I'm hoping after they see your piece, Anna, and they're watching, they're rethinking Daniel's bill. I see why he's so upset, because on a humanitarian level, you got to figure something out, certainly during these times.
Yeah, he said he's not concerned about himself. He's concerned about people who would get that bill, and then what do they do with it? Other people, really.
Yeah. All right. We're all paying attention. Thank you, Anna.